Hello friends, I am Dr. Parthiv Shah, a consultant chest physician practicing at Borivali and ex-assistant professor at KJ Somaya Hospital. Today we are going to talk about bronchial asthma. Why is bronchial asthma so important in a current scenario? India accounts for highest number of mortality from bronchial asthma, that is approximately around 42%. The rest of the world accounts to less than 20%. So we, in spite of having a high number of mortality, we are not aware of the disease. So what is bronchial asthma? Bronchial asthma is basically an heterogeneous disease in which it manifests in a number of ways, characterized by four most common symptoms. The first is wheezing, in which you get a wheeze sound from your chest. Second is patient coughs. Chest tightness, in which the patient feels there is chest tightness. And third is breathlessness. It may be at rest or it may be on exertion. So this is the most common symptoms, right? What are the precipitating factors, or how do you get in bronchial asthma? Bronchial asthma is usually an hereditary disease. It is usually precipitated by exposure to allergens. The most common allergens which we have around us are house dust mites, grass, pollens, fungi, cockroaches, insecticides, pesticides, and more. So, how do we diagnose bronchial asthma? There are two most common methods which are used for diagnosing bronchial asthma. First is the peak expiratory flow rate, which is routine test which can be done in an OPD basis. The second is the most important, is the spirometry. The spirometry is a tool through which we check the lung values, lung capacity, and in which the patient is asked to blow through a small pipe which contains a turbine, and we check the lung values. After giving the bronchodilators, we recheck the values, and if there is significant reversibility, it suggests that the patient has bronchial asthma. This is the diagnostic criteria for a bronchial asthma apart from symptoms. So how do we, now coming down to how do we treat the patient, right? Or how do we treat? The most important treatment for a bronchial asthma are bronchodilators, which includes the inhaled corticosteroids. This is the first line of treatment. The other forms of therapy includes chest physiotherapy, vaccination, and well as the treatment of the precipitating factors or the risk factors for bronchial asthma, namely gastritis, obesity, which are the few, and allergic rhinitis or allergies which manifest in a particular patient. Vaccination is much more important as recurrent infections may precipitate bronchial asthma. For more such informative videos regarding the pulmonary disease, and also if you want to contact me, follow www.lybrate.com and get your queries solved.